years of plastic surgery versus 1 year of training. It makes a difference, okay? So you want to look for a board certified plastic surgeon, went through all that training, and afterwards took 2 exams. One is a written exam, multiple choice. We've all done this probably in different professions that you guys have. And the other one is an oral exam. The oral exam, you can't take it unless you've been at least a year in practice, okay? So that's why if you are considering what's called a board eligible plastic surgeon, that's also good. It just means that they finished all their training. They're clear to work as plastic surgeons, okay? Board certification is not a requirement to operate on patients on plastic surgery after you graduate, okay? So that it's a difference. Having a medical license and having privileges in a hospital and the board certification is 2 different things, okay? So the board eligible plastic surgeon did the training, did the first part of the certification, which is the written exam, and now they're what's called collecting for their boards. So the first year out in independent practice, you have to do a list of all the cases you did that year, send it to the board, they examine that, and they pick 5 cases of that. Which cases? The ones that they want. You don't know. So once they pick those 5, you have to submit all the information of those patients, including the consult notes, pre-op labs, clearance of your operative note, pre-op pictures, post-op pictures, and then they evaluate you on that. Not only about your results, if they're up to standard, but also, and most importantly, if you are a safe surgeon and your judgment, okay? So if you go to a board certified plastic surgeon, you are on great hands because you know that that person has gone through all of this training and requirements to get that certification. And like I mentioned, I'm double board certified because I did all of that for general surgery, and then I did all of that for plastic surgery, okay? And like I mentioned at the beginning, there is a continuous certification and maintenance of that certification. So for me, it's every year I have to take an exam. It's at home. I don't have to go to a center. It's like 30 to 50 questions, keeping me up to date in everything that's going every year. So to keep the certification keeps you up to date in everything, okay? So experience, I put it there because yes, it is important, okay? You want that surgeon to be trained, you want that surgeon to be board certified, but you also want that surgeon to have experience in the procedure that you're seeking for. And before and after is a way of basically showing your experience and your results. It is not everything, but I think it is important. And the other important thing for me is the personality and that you trust your surgeon. So that is why I take my time doing these videos, answering your questions, getting to know each other, because you're putting your hands in someone else's, your life in someone else's hands. And I think it's important that you feel comfortable with that person. It's very hard when you're coming from out of state, for example, and you just meet me the day before your surgery, okay? We have maybe talked, in a consult previously, but face to face the day before, and that's nerve-wracking. But if we go over this videos, I explain everything, you ask your questions, I answer them, then you go and you come to that day well educated and more calm because you have established some sort of rapport with your surgeon. So I think this is very important that you go to someone that you feel comfortable with, okay? Not only choosing your surgeon is important, but choosing the facility is important. You can have a great surgeon that works in a place that the standards are not great. And even though they do a great job, if they don't have the adequate certifications to keep everything as sterile as they need, and they change the equipment as they need it, the facility is extremely important because it goes into something that the surgeon can't control completely, which is the infection rate. Something to ask the places that you are searching is, what is your infection rate, okay? And it's something that they should know. How many of, if you did 100 surgeries, how many of those got infected, okay? And depends on the surgery, the infection rates are different nationwide, and you can look this up, okay? So the procedure that you are interested in, what is the nationwide infection rate, and then the infection rate, the facility you're interested in, what the rate is, and you compare. And I think this is very, very important, because the surgeon could do a great job, but if you get an infection because the instruments were not sterilized the way that they needed to be, the water supply wasn't filtered or anything like that, then your result, not only your results, but also your life, your safety is in danger, okay? So important thing to answer. Let's talk about the reviews. The reviews is something that you should take with a grain of salt, okay? Like everything, people that are not happy with the results are the ones that want to talk more. And this is not only for plastic surgery or for my patients. I'm not trying to say that, I think everyone is entitled to their opinion and to leave a review, 100%. But when you're reading this reviews, and this happens with everything, you go on Amazon and you want to buy something, you read the reviews. There's always a review, 1 star, this is the worst thing I bought, and then there's other ones saying completely the opposite. So same for plastic surgery, take it with a grain of salt, see what they're talking about. There's a lot of things we can't control, and I talk about this a lot in my other videos, and there are some things of the surgery process, your scarring, the way that your foundation is, that we can't change with plastic surgery. And unfortunately, there is going to be people that are not happy with the results, okay? So what things in the reviews are important to kind of read about and get from them. The experience, how the staff treated the patients, the responsiveness. I think those things are extremely important, because we can control the rate of infections, the rate of complications, but we cannot control who gets them, okay? It is never 0. So you don't know if you're gonna be the person, if it's 0.001%, maybe that's you, right? And that's why statistics in surgery in general are so weird, because, it's only 1%. Yeah, but what about if I'm that 1%, right? So it is important, if you get a complication, how does the surgeon and the staff respond? You want someone that is behind you all the way in that process, that answers you and orients you and guides you to the recovery of that complication. I think that is something to look for in the reviews. Responsiveness, the staff, how they felt, how clean was the facility, and of course, if they're happy with the results, right? And where to get the info? Social media, right? No. Social media, it is a great tool for many, many things, but doing your research does not involve social media. You should focus in websites that have reliable information. I'm gonna give you 2 that are very, very good, okay? The first one is called plasticsurgery.org. This website is the website for the American Society of Plastic Surgeons, or ASPS. I am a member. To be a member, you have to be board certified plastic surgeon and be in good standing. What does that mean? That when you apply, you have to get the backup of at least 2 other ASPS members from your community that know you and that say that you are a safe surgeon and you can be part of that society. So this website gives a lot of information. There's a tab that's for patients, and that gives a lot of information about the procedures and all the things that you should be looking for in a reliable source. And the other one, it's called theaestheticsociety.org. That is from the ASAPS, or the Aesthetic Society of Plastic Surgeons. So ASAPS, it's different from ASPS because ASPS includes all plastic surgeons. Plastic surgeons not only do cosmetic surgery, there are plastic surgeons that focus on burns, on hand or craniofacial, trauma, cancer reconstruction. So it's a very, very big window, and that's ASPS. ASPS includes all of those plastic surgeons, okay? ASAPs, it's only the aesthetic plastic surgeons, okay? I am a member of that as well. And to get into that membership is even harder. You need, again, someone to back you up and to recommend you from the community that you work. So it's a very strict society because the main reason is we want patients to be safe when going under the knife and going under an aesthetic procedure. So this is a very, very good source. It has also a for patients tab. You go on there and you can find anything related to aesthetic procedures and plastic surgery. Okay, I will get to answer your questions now if you guys have them.
Okay, we're having connection problems everywhere.
Okay.
But we're fine. Hello, can a tummy tuck and a BBL be done at the same time?
So unfortunately, I don't recommend it. There are two main reasons why I don't recommend combining this procedure. The number one and most important is safety reasons. So I do think that doing that surgery is a lot for the recovery, especially if you are being sent home the same day. So I do surgery in an office-based facility here at the state of Florida, which has some regulations to keep patients safe. So to perform that procedure and send you home and not keep you overnight in a hospital setting, I think it's too risky, okay? And the second one is for recovery reasons, okay? The BBL, I'm gonna ask you to be sleeping in your belly, not putting pressure to the buttock and hip area for the fat graft to survive. And the tummy tuck, I'm gonna ask you the opposite. I'm gonna ask you to be laying on your back, hips flexed, to not put tension on the tummy. So to do both of them without interfering with the recovery and interfering with the results of them, I don't know how we can do that. So I prefer to stage them, and I prefer to the tummy tuck first. So tummy tuck first, and then 3 to 4 months later, BBL.
How do we search if a physician is in any illegal proceedings due to an issue with a patient?
So that needs to, you'll have to go. The problem is that each legal entity, it's per state. So you'll have to go to the state that you are thinking about having plastic surgery and basically Google if that surgeon has any lawsuits pending. That obviously does not include if they have any lawsuits in another state. So that it's kind of tricky. A lot of the groups in Facebook can help you with that, but be careful because sometimes those Google groups are a little bit misleading.
What surgeries can be combined with a thigh lift?
Thigh lift, I don't like to combine it with anything. Let me explain. So if we're talking about a scar revision, something minor, we can add it to the thigh lift. But adding a tummy tug and an arm lift or something bigger, the problem is the recovery. So with thigh lifts, the problem with thigh lifts is that the scars tend to cause more healing problems than any other surgery in plastic surgery because of the position, gravity, swelling, near genitals. So all of that increases the risk of wound openings, infection. So I want you trying to recover, healing that area without any other scars or incisions obstructing that recovery.
The timing for a procedure after a mummy makeover, for example, a Lipo 360 or a BBL.
Very good question. So after a mummy makeover, you should wait at least 3 to 4 months to undergo another procedure, okay? That is to have the swelling come down, also that you are more mobile. I want you up and walking and more mobile and not recovering from another procedure to add the second recovery on top of that one. Okay, you guys, this is it for 2023. Thank you so much for everyone watching the videos. I keep on doing them because my patients always come to Pre-Op and say thank you for all the videos that you do. They were so helpful. So that is the main reason why I do this, because I do think it's extremely important to get good education, and that's why I'm putting these resources in. If you want me to talk about any topic specifically, please do not hesitate to DM me or put it in the comments, and I'll gladly talk about that. And remember, don't miss tomorrow. Hump Day Live with Dr. Alex Earl will be in his account. What's it? Dr. Alex Earl, right? It's all
Dr.Alex.Earl.
Okay, it has dots in the middle. So Dr.Alex.Earl, and it's with an E at the end, early. So remember to join, and we will talk about, especially this part there for 2023, all of our numbers, and bring all your questions. Happy holidays. Hope everyone has a beautiful, beautiful holiday break with their families, and Happy New Year. And I'll see you guys in Tuesday Tips in 2024. Take care.